So you know how to write this symbol. That is every time I'll be showing like this. So whenever you write the RH symbol, you have to write like this. So the first we will be seeing there is the prescription on acute diarrhea. So yes, Ansal, Ansal, Ansal. Hello, Ansal. I am calling you Ansal. After keeping your phone, where are you going? Ansal. Hello. You are not there? Okay. Nihal Mubarak. Nihal. People are not there? Okay.
Yes, ma'am.
Yes. Nihal, for a patient with diarrhea or loose motion, what are the first what you will give?
Sorry, ma'am.
For a patient with diarrhea. You know what is diarrhea?
Yes.
Yes. So, what is the treatment for diarrhea? How will you treat a case of diarrhea? A patient is coming with diarrhea. So, what is the definition of diarrhea?
Mm.
Hmm?
Mm.
Hmm? You know the definition of diarrhea? When will you say we have diarrhea? Hmm.
If you have stools 3 to 4 times a day.
Ah, very good. So 3 to 4 times. It's only hard. Is it hard stool or loose stool?
Loose stools.
Loose stools. Yes, 3 or 4 loose stools in 24-hour period. If it is there, we call it diarrhea. Okay, Nihal. Okay, that is fine. Ansal, are you there? Ansal. Why he is not there? Ansal is not there. Okay, Abdul Musawir. Abdul Musawir. Abdul Musawir. What is this? Shabana Tasnim. Shabana Tasnim.
Yes, ma'am.
How will you treat a case of diarrhea? How will you treat a case of?
Doctor, we have to RS.
We have to. We have to.
Oral rehydrating solution.
Yes, we have to give oral rehydrations.
We have to replenish the fluid level.
Okay, okay, that is fine. So we have to give ORS. So that is what I have written. And is there any drugs that will stop diarrhea? Do you know any drug that will stop diarrhea? Any anti-motility drug? Okay, no problem. Okay, so this is actually, so she has told it is ORS, oral rehydration salt or solution. So this is the picture of a oral rehydration salt or solute or solution. So this WHO ORS, it consists of sodium chloride, potassium. We already seen all these things. Just a repetition: trisodium citrate, glucose, and water. So water, it has to be, these things has to be mixed in 1 liter of water. So usually this is available as this packet. So this whole packet, it should be dissolved in 1 liter of water. 1 liter of water. Then the patient has to take 100 ml after every stool. In addition, we have to give plenty of oral fluids. And there is a drug called loperamide. This is anti-motility. So it will reduce the motility of the intestine, and also it reduces the secretion also. We have to give 4 milligram tablet. 4 milligram. That is 2 milligram, 2 tablets. We have to give at a stretch, followed by 2 milligram if there is further continued loose stool. But only thing, this loperamide, we should not give in children, because it may cause, even in adults also, it may cause paralytic ileus. So only very emergency cases we will give loperamide. Otherwise, we will be controlling only with ORS and other fluids. If needed, we can give IV fluids also. Okay. Now you can write down the prescription. Acute, the heading is acute diarrhea. So these are the things you have to write the body of the prescription. When you get the record, we will write everything in the format. Now you can just write down the body of the prescription. Because very soon I think the college may be reopened because most of the batches have come, and I think so. Okay, so you can write down in your book, you can write down. Have you finished? Jisha Jiri, have you finished writing? Jisha.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Finished. Okay. So we will go to the. Is it over, everyone? I think it is over. Okay. Now next is acute cellulitis. This acute cellulitis means you would have seen the patients having such a condition. It is actually an acute bacterial infection of the skin and subcutaneous tissue. It is called cellulitis. So skin as well as the subcutaneous tissue, it will be inflamed and there will be bacterial infection, and usually it is staphylococcus or streptococcus infection, and there will be redness, warmth, swelling, etc. And there will be pain also. So this is called acute cellulitis. So, yes, Abdul Musawir, have you come back? Abdul Musawir, have you come back, Abdul Musawir? So if you're not answering, I will make you absent. Even if your name is there, I will be keeping as absent. Okay, so now Swadi. Swadi, are you there?
Yes, ma'am.
Yes. For streptococcal and streptococcal infection, what is the ideal antibiotic?
Cloxacillin. Cloxacillin.
Cloxacillin or?
Penicillin.
Yes, penicillin group. Streptococcal infections, it is the penicillin group. So that is why I have written the drug, that is amoxicillin. It is a penicillin group. So we had to give 500 milligram 8 hourly for 7 days. And also a mixture of amoxicillin and cloxacillin also should be given. And there will be pain, inflammation, redness, etc. So we have to give one NSAID, that is aceclofenac and paracetamol. These are all NSAIDs. Then there is another proteolytic agent that is called serratiopeptidase. So if there are combinations are available. So if you are giving serratiopeptidase, this inflammation, all the inflammation will, the pain inflammation, it will be substituted by the aceclofenac, paracetamol, and in between the tissue, that all those collections, everything, it will be reduced because this is proteolytic. So that is serratiopeptidase. This combination, it has to be BD for 3 days, and we have to review after 5 days. So there is a combination of, a course of antibiotic and analgesic anti-inflammatory for acute cellulitis. Okay, now you can write down the prescription. Is it over? Swati, have you written? Finished writing?
Yes, ma'am.
Yes.
Yes, ma'am.
Yes. Then we will go to the next slide. So I think all of you have written.
Yes, ma'am.
Yes, yes. Who has responded? Who said yes now?
Ansel Kabir, ma'am.
Ansel Kabir, where were you?
I was all day. I was here, ma'am.
I called you several times. You were not answering.
Seriously, I didn't. I thought you were calling Abdul Musawir, ma'am.
No, first I called you. You were not responding. Show your face. I just wanted to see whether you are.
Okay.
Show your face. Sure. I called you several times, but you didn't answer. Then I called Abdul Musawir. Abdul Musawir also, he didn't.
Oh, I didn't hear you, ma'am. Actually, just
Oh,
I was
okay,
here
no
all the
problem.
time.
Wait. No problem.
Yeah.
So, next prescription is
Yeah.
duodenal ulcer. Okay.
Stop the video.
Huh?
Nothing.
Okay. Duodenal ulcer, what are the drugs? Peptic ulcer. Switch off the video. Okay, tell me what are the drugs?
For what, ma'am?
Peptic ulcer. Peptic ulcer.
I-
Mm.
You didn't tell that. You just told about.
No, I didn't tell. We had a class on peptic ulcer, no? So you should know the drugs. So at least one drug you can say. One drug for peptic ulcer.
Mm,
No idea? So now Abdul Musawir is there or is he absent? Abdul Musawir. He is there, not there. Okay. Okay, then who can Abhirami, can you tell me some drugs for peptic
yeah,
ulcer?
ma'am. HI blocker.
Ma'am, Sokral. Let
Who
him say that.
H1
H1?
H1 blocker.
Not H1 blocker, H2 blockers. H2 blockers. Okay. Or PPI. No, who was telling the answer? The other thing? Abhirami.
Ma'am, Sokral Faith, ma'am.
Sucralfate we can use. Who is that? Abhirami?
Yes, ma'am.
Okay. Any other drug?
Then omeprazole H, that is H2 blocker.
Yes. Omeprazole. So it is a proton pump inhibitor. But when we have this H. pylori infection also, so last class I was telling you can remember LAC. That is a regimen for duodenal ulcer if there is H. pylori. Usually they have seen that there is actually chances of H. pylori that is causing the peptic ulcer. So the one of the regimen, there are different regimens. It is a combination of lansoprazole, amoxicillin, and clarithromycin. The first name you can remember, LAC. L means lansoprazole, A means amoxicillin, C means clarithromycin. So this is a proton pump inhibitor. Penicillin, this is a penicillin type amoxicillin, this is a macrolide. So all this, it should be given twice daily for 2 weeks. So you can see. So the side effects will be very much because all are in high dose. 30 milligram amoxicillin, 1000 milligram BD, that is morning 1000, evening 1000. Similarly, clarithromycin 500 milligram morning and evening, like that, all the drugs for 2 weeks, and review should be taken after 2 weeks. This is in the case of where we find H. pylori in the peptic ulcer, or even simple duodenal ulcer. If you give this course, it is very good, but the side effects, the patient may not be able to tolerate because of the nausea, vomiting, etc. Because of the side effects, they may be. It is very difficult, but if you give for 2 weeks, it's good. Okay, now you can write down the prescription, duodenal ulcer. In your book, you can write. Over. Abhirami, have you written?
Yes, ma'am.
Yes. Hope everyone has written. So we will go to the next prescription. Okay, 1 minute. Ansal, have you written?
Yes, ma'am.
Show me your book.
Oh,
Show me your book. Open your video and show me your book. Why? Where were you writing? Did you write?
No, I'm getting short.
You were not right. Screenshot. I have told you. Don't.
Yeah, I'm going to write. I'm going
So when I am giving time, you are not writing and you are just telling I have written. Okay. Okay, then I can catch you afterwards. Okay. So we will go to the next topic, acute attack of malaria. So Ansala, I'll be asking you to show your book. After this, I'll be asking. So acute attack of, 1 minute, I'll just, please listen. So now the next prescription is acute attack of malaria. Okay. So who can say, I had to ask someone, Abdul Musawir, have you come back? No. He's absconded. Okay. Rishana. Yes. So what is the treatment for malaria, or what causes malaria? Which mosquito transmits? Is it through mosquito or through, it is a bacterial infection or a viral infection? How we will get malaria, the infection malaria? Hello, where did you go? Rishana, you left already? Immediately you left? Hello, Rishana is there. Okay, tell me.
Yeah, hello, ma'am.
Yes, tell me. How is malaria transmitted? How we will get malaria? Any idea, Rishana? If you don't know, I can ask.
Mosquito.
Mosquito. Yes, which mosquito?
Anopheles.
Anopheles. Is it male or female?
Female.
Female mosquito. Okay. So it is caused. Okay. Then I'll ask some other person. This one.
Yes, ma'am.
Can you tell me one drug for malaria? Treatment of malaria. One drug. At least
Chloroquine.
one. Yes, chloroquine. Okay. Then we will see the. Okay. Very good. So this is the cycle of malaria. So this is the female Anopheles mosquito. This mosquito in the salivary gland, they will be having the sporozoids. So when it bites a human being, the sporozoids, you can see the sporozoids, it comes and it is going in our body, it will be going to the liver. And the liver, there will be multiplication and lot of merozoites are formed. And these merozoids now enters our red blood cells, RBCs. So inside the RBCs, it undergoes multiplication and finally the RBCs rupture and lot of merozoites will come out. And when it rupture only, we are having this fever. And this merozoites, some of the merozoites, it will become gametocytes. And then finally, if another mosquito, if bites another malaria patient, this gametocytes will be taken by the mosquito. So in the mosquito's body, it is again undergoes further multiplication and forms sporozoids, and it will be coming like that. So understood? Sporozoids come to liver, multiplication, then merozoites enters RBC, then some of the merozoites forms gametocytes. It is taken by the another mosquito, not maybe another, it may be the same also. So then multiplication inside the mosquito, and so the cycle completes. So this is actually the life cycle of malaria. So the drug, as he has told, it is this one. It is chloroquine, one of the most important drug. It is most of the malarial plasmodium it is sensitive to chloroquine. Some cases it will be not sensitive. So what you have to give is what you have to do is chloroquine tablets. You can see 4 tablets. See, It's very difficult, no? So 150 milligram, that means 150 into 4, 600 milligram. At a stretch, they have to take 4 tablets immediately. So that means when it is diagnosed, we will be testing the peripheral smear, and we will be, if the diagnosis is confirmed, immediately you have to start the tablets. 4 tablets, that is 150 into 4 tablets, that is 600 milligram. Immediately we have to give. Then after 8 hours, so for morning, if you are giving at 10 o'clock, 10 plus 8, that is 6 o'clock, again you have to give 2 tablets, that is 150 into 2, that is 300 milligram. Then next day and for another 2 days, again 2 tablets. So that is the chloroquine, the schedule. And in addition, Primaquine also should be given for 14 days. After this course is over, we have to give Primaquine 50 milligram once daily for 14. This is the for radical cure. Those sporozoites, everything that is happening in the liver, it will be destroyed by this Primaquine, so that further transmission it will be stopped. So chloroquine and Primaquine, these two are the important drugs. For resistant malaria, other prescription is there that we will see later. And we have to review after 2 weeks. So this is a 14 days treatment. No, first it will be 2 days, then around 16 days treatment. So after 2 weeks, we have to review. Okay, now you can write down acute attack of malaria. I'll ask everyone to show your notebook. So please write it in your notebook. Should not take a screenshot because it is a waste. You have to write it in your notebook. Over? Have you written? Still going on. Okay.